And our website is mybrightpoint.org. So I will put that up later. Our programs at Brightpoint, we have child and youth development with early Head Start, on my way pre-K. We have financial education, child care assistance. One of our main programs that we have is energy assistance, which is a very popular program. And then the one I'm part of is the health coverage assistance, which is covering kids and families. And then covering kids and families, we cover, our vision is for all Hoosiers to have accessible healthcare coverage, and we cover the Northeast Indiana. We have, excuse me, 11 counties. So Allen, Adams, Noble, you can see up there on the map there. And then basically what we do is we help people apply for Medicaid and really marketplace if they're over income for Medicaid. We help them to understand what their coverage is, and we help them to report changes, submit documents, make payments and that will be starting in July, which I'll get into a little bit later. And that's so that, and we get their mail. So after a year, even though like we'll help them now, we'll still get their mail a year later because we're still their authorized representative, and we'll still keep in contact with them and see if they still want us to be the AR. And we will continue to change their, make changes for them, call the Division of Family Resources for them, and that sort of thing. So we continue to stay with them. And then this is just an overview of the Healthy Indiana Plan, 19 to 64, HIT Basic, HIT Plus. And then here's Hoosier HealthWise. These are just basic. We do a presumptive eligibility for pregnant women. There is a presumptive eligibility for medical, which we do not do. The presumptive eligibility for pregnant women is good once per pregnancy. It is good. It's free. It's good until the Medicaid is either approved or denied. It can be used as a secondary insurance, but it's good for prenatal only. So it's only good for ultrasounds, blood work related to pregnancy only. And then Hoosier Care Connect, which goes along with that for individuals that don't receive Medicare. And then we do traditional Medicaid that does go along with Medicare. And then Medicare Savings Program, so it also goes along with Medicare, that helps pay for Part A and Part B premiums. So we don't handle Medicare per se, but we do help with the secondary insurance to Medicare. And then health insurance marketplace. So that's just an overview of Point and covering kids. So I wanted to mostly focus on the unwinding, which is what's coming up next. So the Medicaid unwinding, there's big changes coming. They mostly started April 1st. There's a few ways to help people stay covered. Navigator assistance, which is what I am, with fast track payments, power account payments, and CHIP payments, and then just the Medicare unwinding. And over 2 million Hoosiers are covered under Medicaid. So that's 1 in 3 Hoosiers. So that's a lot of people. And thousands of Hoosiers could lose health insurance because of the changes that are coming, that have started already. Oh, I gotta move this over here. Okay. So basically what was already said was that previously, before COVID, every year people had to redetermine. And because of the public health emergency, that changed, and they made what was called continuous coverage. So nobody was kicked off. So no matter what your income was, you could be making $50 an hour. If you were already on Medicaid, they did not kick you off. However, that has changed because they ended it as of December 29th of 2022. So they started the end as of April 1 of 2023. So that all started already. So they've started to send out letters, which I did not put any copies of the letters in here, but I can get them if people need to see what the letters look like. But there's thousands of people at risk of losing Medicaid, and there's many reasons why. Here's some of the main reasons. they don't look at their mail. Their mail is in a different language than what they speak. So sometimes, like when we apply for people, we can pick their language. We can pick Spanish, we can pick Burmese. So their mail will be in that language. If it's not chosen in that language, it will come in English. So if you are a Spanish speaking individual and you get your mail in English and you're not really good with English, you may not pay attention to it and you'll just throw it out. That happens. So then they won't get their mail and they won't recertify. They may have payments starting in July with HIP or CHIP, and they can't afford the payment. Even at $1, some people can't afford that. They may not receive their mail because they haven't given their addresses updated, and they haven't updated their addresses with the Division of Family Resources. And those are just several reasons why. And if they don't update if they don't update their information, it could cause a lapse in coverage. Or they could just end up insured completely. So what the review process will look like is the states have up to 12 months to complete this review. So it started in April, so it's a journey. So it's not something that's just going to be, it's going to take a while to complete. But if they do contact somebody, they do have to give them 30 days to respond. If you didn't meet eligibility requirements, you could stay on your coverage, but now you're losing it. An example is, and these are just changes that are coming, but an example of what could happen during this change period is if a member had pregnancy coverage from HIP, but had their baby more than a year ago because they made it. It used to be, you used to have 60 days postpartum, but they made it. So now you have 12 months, which is awesome. So now after the 12 months is over, if you're over income, you will be discontinued for Medicaid if you're over income for HIP. And the HIP guidelines, the income limit for two people is not that high. So the chances of you getting kicked off are pretty good. Sorry. And she did say that 500,000 Hoosiers could be losing Medicaid, which is true. It's a shame. It's a lot of people. But if you have your renewal date was in September of last year, it will be in September of this year. So the people, if they knew that you had a change in income, because they do get data, I forget what it's called, but they do get data throughout the year that says if your income has changed. So they will redetermine you in April. If they get that information, they'll send you a form that asks for your income. And if you don't turn it in, or if you're over income, they will kick you off. If they have not received any data like that, then they'll wait until your redetermination date. So in this instance, if your redetermination date was in September of last year, they'll send you a document in August of 2023 and say, here's what we need to prove that you are able to still be covered under Medicaid. You need to provide your income, verify your address, fill out this document and send it in. And then they give you a certain number of days to do that. And then they will redetermine you or discontinue you. But they always send the document out a month before your redetermination date. You can find your redetermination date in the FSSA benefits portal. You can find it by calling your MCE, which is your managed care entity, which would be Anthem, MHS, CareSource, or MDWise. So ways to stay covered would be making sure your information is updated. You can update it through the FSSA benefits.indiana.gov benefits portal. You can call 800-403-0864. Those are the best ways to do it. You get a hold of a navigator, which would be me. And here's a link here that you can go to that would be able to point you in the direction of the navigator closest to you, depending on what county you live in. And this is how navigators can help. If you are requesting documentation, I've had situations where I've just had a client call me out of the blue because they knew somebody and they were referred to me. I've helped them turn in documentation. People I don't even have as a client, I've helped them turn in documentation. So that's what navigators do. We turn in documentation, we follow up, we just basically advocate for the client. We can become their authorized representative and definitely make sure that things are going right for them. We can point them to employer coverage if for some reason they do get discontinued from Medicaid and they are offered employer coverage. Because if they are offered employer coverage and they're discontinued from Medicaid, they cannot get marketplace insurance. Well, that's not true. They can get marketplace, but they can't get the premium tax credits. So they would have to pay a full premium price, which is pretty pricey. Let's see. Okay, so if they lose their coverage, we can try and figure out why. We can help them make fast track payments and their PAC payments, which is the power account payments, which I'm going to discuss in the upcoming slides. Okay, so a fast track payment they can do during their application process. So it's an option that they have. They can do. It's a $10 payment, so it would go towards their monthly power account payment. So if their power account payment was $1, which if your income is less than 22%, if your federal poverty level is at less than 22%, you only have to pay $1 a month for your HIP Plus plan. Then if you decide you have enough money to pay that $10 right away, one, it starts your plan sooner, the effective date is sooner, and two, it goes towards your power account. So you would only then owe $2 for the rest of the year, because it would be $12 for the year at $1 a month. Payments can be made by debit or credit at the time the app is submitted or after applying. You do make it to the MCE, so you would make it to Anthem, CareSource, MDWise, or MHS. They will send an invoice. So you have 60 days to make the payment. If you don't make it right away, you have 60 days to make that payment before you're enrolled in HIP Plus. If you do not make that payment, you will be enrolled in HIP Basic. HIP Basic does not offer vision and dental, and it does have copays. So HIP Plus is probably the better way to go if you're able to do it. However, after you make your payment, your fast track payment, you cannot change your health plan until open enrollment. Let's see. So the power account is basically an account that you have that the state of Indiana pays for most of it, but you do pay into it through your power account payment monthly. So you could end up paying $12 into the $2,500, and that would be your only portion. So really the state pays most of it, but that pays for your bills, your monthly bills. So, and even if like I said, if you don't pay it, then you get dropped down to basic, which you would have to pay $4 and $8 copays for doctor's appointments and prescriptions. The only cost you have to pay for HIP other than your monthly is a non-emergency room visit. Let's see. So there's more about the power account payment. They are paid directly to the health plan. So we don't take those payments where I am. We can take the fast track payment at application time, but we cannot take the power account payments. They go straight to Anthem or MDWise, CareSource, or MHS. Or there are locations that you can make those payments. I think you can go to Walmart. At least you used to be able to at COVID time. I'm not sure the updated places where you can go. This is the power account payment chart that tells what so like the FPL, the federal poverty level, is less than 22. So as a single person, you'd be paying $1. If you were married, you'd both be paying $1. Tobacco surcharge, after a year, you do pay 50% more. So that's after a year though. So they kind of want to give you a chance to quit smoking. But you can see, like, if you both smoke, then you both pay $1.50 if one smokes and one doesn't. So that's just kind of how that chart goes. And then you jump into the Medicare unwinding, where a lot of people didn't do Medicare because they were able to get HIP coverage. So now they're doing a special enrollment period for Medicare. It looks like you cannot have Medicare and HIP. So if you're Medicare eligible, they're going to cancel your HIP as it is. And then we're going to get you situated with either traditional Medicaid or like the Medicare savings program. If you have a client that needs help with Medicare, because unfortunately we do not do Medicare, you can have them have a state health insurance assistance program, which is SHIP, and here's their contact information. And then these are just the sources that I found all this information at. This is our contact information. You can refer people to us at Brightpoint for appointments. These are the counties we serve. General questions, if you have just a general question, they can email the CKF at my Brightpoint mailbox at mybrightpoint.org. This is my program manager, Tequila Nelson, and then there's me. And then questions.
Awesome.
And I can give the slides out too. And okay. I can stop sharing. Okay.
Thank you. Thanks, Ty. Thanks for that, all that great information. So basically, we as leaders in the community, human services providers and healthcare providers, we want to be on guard for this because we know that people we serve, and perhaps some of us as well, are in this situation where we know that this deadline is looming, depending on when you were enrolled in the program. And we need to make sure that our people know that this is happening, okay? We basically need to be the eyes and ears for them that know, so that they know that this is happening. Like Ty was saying, if, they speak a different language and their mail is coming in English and they're just throwing it out, then next year they might go to the doctor and they say, well, you don't have coverage. You see what I'm saying? And so this is not small stuff here. This is big stuff that definitely affects families. Do we have any questions? Yes, Terry.
If someone's proactive and they go on the portal and they update their information like sooner than they get a letter, are they covered? I mean, have they taken care of what they need to do in order to try to remain eligible?
Okay. Did you hear that, Ty?
Yeah, if they should do that as it is. Anytime you change your job, anytime you move, you should always be uploading stuff as you go. But definitely it's better to be proactive. Then they still may send you the letter to recertify, but if you've already sent your information, they may not ask for it again. They might just send you the auto renewal letter, because there's two different types of renewal letters, redetermination letters. One is an auto renewal, meaning they've gotten all your documentation throughout the year that you've needed to send. And the other one is the redetermination letter requesting you to send documentation. So you may just get the auto renewal letter if you've already sent it as you go.
So it looks like you're going to get a letter either way. You need to look out for the letter. Right? So we need
yes, ma'am.
to look out for this letter. Did you have a question here?
I did. So I work with kiddos with autism, and so a lot of our families are eligible for Medicaid because they have the family supports waiver. Otherwise, they wouldn't have been eligible. I didn't know how much you knew about that, or if there's any similarities or differences with this process for those families.
It's the same.
It sounds like
I co-own a behavioral company. It's
okay.
The same, and your case manager. So basically, and that was a question I had, was, and it kind of ties into yours, is this renewal process the same as what it was previous to COVID? So was it just like on a halt? Because our families are going to know what this is because they had to go through this if they've been on it. But to me, it seems like the people that are going to be most affected by this are the ones that either just got on Medicaid in these last 3 years during COVID, or at the end of it and had never had to go through a renewal process. And that's like a twofold question. So the first question is it the renewal process the same as or different than it was pre-COVID? And then the second one is to answer you, but I kind of want to know what that question is first.
What's your question first?
because regarding this question is the case managers normally handle that. Is what I'm saying. To your answer to your question is,
so is it the same
waiver,
for
your case manager
for families in the autism spectrum right?
Right.
It should be the same renewal. It should be the same process as for everybody, from what I understand.
And then is it the same renewal process as it was pre-COVID?
Now, I wasn't here pre-COVID, but I'm gonna say yes, because based on The documents, because I have been on Medicaid previously, and based on documents I've received in the past, it looks the same.
Any other questions?
It-
Do we have
It's
any
still
questions?
asking for your income, your address, stuff like that.
Okay,
If I were you, I would tell your families to contact their case managers and say, we were just at a training, this just came up, this happened in April, like, that's what I'm gonna do just based upon this. I'm gonna have my business partner send out an email to all of our clients. This is getting reinstated as of April 2023.
Yeah.
Because I don't think anybody has really been made aware, like, this is the first time I'm hearing about it, and we own a Medicaid billing company, and we bill Medicaid monthly.
Oh, yeah.
So, yeah, right. So if I were you, I would contact your powers that be and ask them to send an informational blast out to your people. This is
Yeah.
coming back, this just got reinstated, and they need to be
Yeah.
looking at and contacting their case manager.
so this is helpful information. We all need to be on guard and make sure the people that we serve in our families too are aware of what is happening, what's going on. It looks like we don't have any more questions, Ty. We will be sending out her slides, so with her information, her contact information, so that everyone will have that. And right now, we're going to go on to our second presentation with John, with Alzheimer's Association. So John is going to talk a little bit about Alzheimer's awareness as a precursor to a workshop that he's going to put on here at HealthVisions next week. Come on up, John.
Awesome. Thank you. Sending out some other information that wasn't at receipts this morning. One of which is our care and support card. It kind of has the Cliff Notes version of everything the association has to offer. I'll touch on all these, and on the other side is ways to get involved.
And John, is there a way that we can maybe send a PDF to people?
Yes, can send it to Felicia later today. Another thing that's going around is one of our bookmarks. We have many of these. This one is our 10 absolutes, and it's more about meeting the person with dementia and Alzheimer's where they're at. And it certainly helps. We pass this out with our effective communication skills and strategies in that program. And so this is really, really helpful in meeting folks where they're at that do have the disease. And of course, my card. And the main thing on the back of my card, we have magnets with this information, but we're running low. So I'm sparing that a little bit. But our 1-800, our helpline number, that's available 24/7 for folks, families, any time of the day to talk to one of our helpline specialists that will help walk through any situation, whether you can't sleep at night because you're worried about your neighbor, or you need to call right now because you have a loved one in the hospital and there's a whole situation. That number will help anytime. I'm available during the day. I am not a social worker. I am new to the whole healthcare, especially like the elder scene. So you don't want me necessarily handling those situations. Our helpline is going to help you most directly. But that is the information there. So to kind of, oh, awesome. We have the presentation. That's okay. So pulling some information up. Again, I'm John Miller, the program manager with the Greater Indiana chapter of the Alzheimer's Association, serving North and Northeast Indiana. So I cover all the counties from Decatur and Adams County up and over and through over to St. Joe County and South Bend. Most recently, after I've gone through my onboarding since November, I've been spending a little bit more time out in the North Central region, getting to know folks out there after I've kind of gotten my foothold here in Allen County. My personal tie with the disease was my grandmother. As far back as I can remember, I was just told she's just forgetful, learned a lot of patience at a very young age, and just bearing with it. And we never knew how bad the situation was until my grandfather had passed away. And while she was still in her own home, we did not know how bad it was until we were starting to get 24 phone calls a day and voicemails from grandma who's angry, and we forget about her even though we just saw her yesterday. So those kinds of situations where it ultimately ended up where she had left the stove on, and Father, the priest from down the street, caught her walking several different times to church because she always just figured it was church, time for church. And so it got got to a point where we had to do something. And I wish that my family had these same resources that I'm going to talk to you about today. And so my personal connection there, and I'm sure we have some similar stories in the room. Can you go to the next slide? So the mission of the Alzheimer's Association leads the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. Fortunately, the Alzheimer's Association is leading this way because left unchecked, Alzheimer's will destroy our finances, our families, and our futures. Next. So the strategic goals of the organization, which I found super awesome coming into the role, but overall for the organization is providing and enhancing care and support, which is a lot on my role, accelerating research. I'll probably touch on this again. Alzheimer's Association is the #3 supporter of Alzheimer's research in the world. #1 is the US government. #2 is the government of China. #3 is the Alzheimer's Association. And we are funding research and projects all around the world. Strengthening diversity, equity, inclusion. We've got a huge kind of push on that now, knowing that we have all these different gaps like many of our organizations have realized, and we're just trying to bring everybody to the table and just with the health equity and this opportunity for our free resources. And getting the word out and starting this discussion early, because as our research has shown and some of the treatment developments, early diagnosis is the key to any preservation or extension of mind and where you're at now. And so it's important to have these conversations, which are hard. It's really hard to talk about, but we have programs and resources to help you have those conversations. Advancing public policy, we have a huge couple folks and a very strong advocacy team across the country that had recently turned our state house in Indiana in February purple. I was down for that and just had some opportunity to get involved in that front, but also increasing revenue through our fundraising. So we need to fund the research and find the cure. Next. So just to make sure we are all aware, dementia is the umbrella term for the cognitive memory loss and those kind of symptoms. While there are specific forms of dementia that are diagnosed, the most common being Alzheimer's. There's several others, several hundred others, but these are the other most common ones, and there are mixed dementias. So dementia is not a single disease, but the overall term, like heart disease, that covers the wide range, specific medical conditions, including Alzheimer's. Disorders grouped under the general term dementia are caused by abnormal brain changes. These changes trigger a decline in thinking skills, also known as cognitive abilities, severe enough to impair daily life and independent function. They also affect behavior, feelings, and relationships. The disease accounts for 60 to 80% of cases for Alzheimer's does. Vascular dementia and others are also prominent, and there are many other conditions that can cause symptoms of dementia, including some that are reversible, such as thyroid problems and vitamin deficiencies. But other dementia will start out slowly and gradually get worse. If you or someone you know is experiencing memory difficulties or other changes in thinking skills, don't ignore them. See a doctor to determine the cause. And also get connected to help and support to answer your questions, like I mentioned with our helpline and our website, to get through your diagnosis. So let's take a little bit more of the bigger picture. And, yeah. No, it won't. it's okay. So it's kind of startling, right? These numbers are our most recent numbers from Facts and Figures that were published, came out March 15th of this year. So these are pretty hot off the presses, these numbers. They didn't change a ton as far as diagnoses go and things from 2022 to 23. Or I guess 21 to 22, but more of the information was surrounding our caregivers and the kind of the information with them. So kind of show of hands, how many of you know someone who's been diagnosed with Alzheimer's or dementia? Right, the majority of folks in the room. So taking a look around the room for a moment and consider how widespread the impact of Alzheimer's disease and dementia can be. More than 6 million Americans have been diagnosed with Alzheimer's, and the totals with Alzheimer's and other forms of dementia are even higher. These are just diagnosed numbers. It's obviously affected us, but worldwide the numbers are staggering. And one of those stats there, that 4 in 10 Americans say they would see a doctor right away if they experience dementia symptoms. The majority, 60%, would wait or not see a doctor at all because we have trouble talking about it. We don't know how to broach the subject. A lot of people that have the symptoms hide it, and they hide it well. And that's why it's important to bring the whole family and loved ones in on the conversation to notice some of these changes. And some of those we will go over in the 10 warning signs, but I'll touch on that. So we know there are some hurdles with some of this information along the way, with some people not getting diagnosed soon enough. You can go to the next slide. And so we know that discrimination is a barrier to Alzheimer's and dementia care. These populations reported discrimination when seeking health care, and we know this. At the Alzheimer's Association, we believe that that diverse perspectives are critical to achieving health equity, meaning that all communities have a fair and just opportunity for early diagnosis and seek access to risk reduction and quality care. The association is committed to engaging underrepresented and underserved communities and responding with resources and education to address the disproportionate impact. Go to the next slide. So some of the other specific, kind of going down into these stats. So Black Americans in Alzheimer's disease, they're 2 times as likely as white Americans to have Alzheimer's and other dementias, but are less likely to receive a diagnosis. Half say they have experienced discrimination while seeking care, and nearly 2/3 believe medical research is biased against folks of color. So that's why we need to have these conversations about the importance of having an early diagnosis and having thoughts and reaching out and seeing these, understanding the disease more and knowing the warning signs. You can go to the next slide. And that continues with the Hispanic population as well. About 1.5 times as likely as white Americans to have Alzheimer's and other dementias. Close to 60% believe that a significant loss of memory or cognitive abilities is a normal part of aging. I grew up thinking that myself, with how close we were with my grandmother and some other folks in our family. I thought it was inevitable. And that's what I've learned since November and starting in the role, is that it's not. It is not a normal part of aging. There are normal parts of aging and memory loss, but Alzheimer's and dementia is not. And 1 in 3 report that they have experienced discrimination as well. Kind of next slide. And another, not so fun fact, but women in Alzheimer's disease, more than 10 million women are either living with Alzheimer's disease or caring for someone with the disease. 60% of Alzheimer's and dementia caregivers are women. And we know that women do live longer than men, but, and that's being a part of that statistic, but 2/3 of Americans living with Alzheimer's are women. And so that's something to really watch out for. And you can hit the next slide. And again, just our commitment to diversity, equity, inclusion. I will share, I remember this on the way in this morning. We have a new DEI director for the Greater Indiana chapter that came into play this month. Vivian Carter, she started in our Indianapolis office with our team, and her mission is to help with this across the state. So I'll be working with her a lot more closely after she gets a little bit better stance getting started and acclimated. But we're really excited to have her on the team, and we have we have received a donor gift as well behind this initiative, and it's one of the largest that the association has seen, and especially in the state. So we are committed to it and bringing these resources. If you can hit the next. So in Indiana alone, there are more than 110,000 people aged 65 and older living with Alzheimer's, and 216 Hoosiers are caring for them that we know of. And so you can go to the next slide too. So who are these caregivers? We mentioned before, 2/3 of caregivers are women, 1/3 are daughters. About 1 in 3 caregivers are 65 and older. A quarter of dementia caregivers are sandwich generation caregivers, taking care of both an aging parent and a child. I know my folks were part of that when I was growing up. It definitely takes its toll on the workforce too. So having these education programs for your employees is even an awesome option to show your support and interest in their knowledge and health. But 41% have a household income of $50,000 or less. That is already hard to get by. Now you're caring for other people, likely living with them too. You hit the next slide. So I mentioned too from the survey in our numbers that the caregivers report higher emotional and physical stress, and really the mental health is really kind of push that we have for our caregivers now, reminding them to put their own mask on first before helping the folks next to them. But nearly 6 in 10, almost 60% of family caregivers rated their emotional stress and caregiving as very high. 30% increase in depressive symptoms while caring for a spouse. It's hard, we know it. And 72% of family caregivers experienced relief when that loved one has passed. I know our family did. It is a relief to finally kind of breathe and kind of take that weight off. Moving right along, there are resources. We can skip this one. I don't think we have time. But that was a testimonial on an individual that had gotten involved with the association for taking care of her husband, and got involved with a support group that we have, which we have all over, and I'll touch on that here. So our free and educational programs that we have, I'm on a mission to bring the awareness, having awareness presentations like this all over, and talking about our resources, our educational programs, and our support groups that we also have as well. Recruiting volunteers to help me provide this information too. So all of our education programs we do have available online and hosting them in person, which you would have received the flyer that is happening here at HealthVisions next Thursday at 10 o'clock. In person or online. So that's just one example. So we can go over some 10 warning signs. Get to the next. We talked on the research happening globally, 300 million in so many different active projects around the world. And specifically here in Indiana, there's a lot of trials and research going on with Lilly, and that is a huge opportunity that we have here in Indiana. Go to the next. Cruising right through here. So how you can help and get involved as an individual, sharing your experiences, being an advocate, volunteering. As an organization, you can get involved with our walk or other fundraising opportunities. You can become a program partner, hosting support groups or education programs like Sharon and everybody here for next week. We would really love, I'd love to connect with you and know how we can bring our education programs to your people. And getting involved, especially in sharing our helpline information in our website. Next. Advocacy I touched on is another way to get involved if you're interested in that. There's some one-off emails that you can get and just click and send emails to your representatives based on your location. You can go to the next. Another big one is our Walk to End Alzheimer's. Has anybody been involved with our Walk to End Alzheimer's in the past? No? All right. Well, I've got some other flyers on that. So our Walk to End Alzheimer's is our biggest fundraiser to help our funding and research. It is happening the first Saturday of October. I want to say it's October 7th or 10th. The first Saturday of October at Parkview Field is where it will be this year. And my counterpart, Cassidy Engel, she is our walk manager. You can get in touch with her on that. You can get the next one. If the walk isn't your speed, there's another way to get involved with fundraising called The Longest Day. The Longest Day is a fundraising opportunity based around the summer solstice and the day with the longest light. It's an opportunity to kind of do your DIY kind of fundraiser. If you love, if you have a cards group or a arts and crafts and you're selling at a farmer's market, or you're going to host, a pickleball tournament, something like that. There's ways to build money and funding around that, so you can talk to us about that. Next one. Our 24/7 helpline, our free education that's available online, and we're working to bring it in person to all of your people. All of our programs are free, so there's no cost involved with that. And another huge resource is our community resource finder. This is a tool. It's available for anybody. It's a partnership with AARP that folks can hop onto. You can click the Alzheimer's Association logo and find any of our events and programs that are happening in your zip code or surrounding area. And that will be super helpful. So, and the last one is another plug for next week. Join us. I have a lot more resources and everything, but the 10 warning signs is a huge intro to understanding more and how to watch for your loved ones.
Thank you, John.
Yeah.
That was a lot of information.
It was.
And it was a lot of great information, and I thank you. And just out of transparency, I am very interested. Dementia runs in my family. And I'm always, when I forget things, I'm like, okay, it could be early dementia, or I'm serious. So I will definitely be listening in next Thursday here at HealthVisions Midwest offices at your presentation. And I encourage everybody in here to tell your clients, tell people that you engage with, you can come. Tell your family members to come. And they need to register. And so the registration information is on the flyer that you received. And if you're online, we will send that information out to you. So this is going to be a great event. And I commend John because you saw the disparities and the people of color who are affected disproportionately by dementia. And how they feel about the medical treatment that they receive. Well, the Alzheimer's Association really wants to dig into the Southeast community and provide some of their great support groups and things like that in the Southeast. He wants to strengthen that arm in the Southeast community, and so this is one of the ways that he's doing that. So thank you, John. Thank you, Ty, as well, for your presentation earlier. We can just give a hand clap. Person and online. Moving right along, we've just got a few more announcements before we start our networking portion. A-check announcements. Here at HealthVisions Midwest, like I said, I want Cassius to come on up so he can be in the camera. I don't know if his face was on the camera last time.
Oh, yeah. No, they got a half an eye.
So Cassius is our new wellness coordinator. Is he in the camera?
He's there.
Cassius is our new wellness coordinator, and he's going to be doing some great programming activities in the coming months. I've started him out on a fast track, and his first program is going to be, when you tell a little bit about that.
For Aspire?
Yes.
Yeah. So Aspire, we will have that official date now, June 1st, the Thursday, so it'll be Thursday, and then it'll be pretty much ongoing every other Thursday from that point on. That first one that we'll touch on will be that first month. All of June will just be for the young people. Gearing up for the summer, that first talk will be someone in the community, and we'll just share, just some things that young people can do for the summer, or just some things, how do we change some things for some stuff to happen for the young people.
And that's our virtual program that comes on during the lunch hour. June 1st, Thursday at 12 noon. We'll get you more information about that. So we started Aspire last year, and Cassius is gracious to take that on. Cassius has a background in human services. Where have you worked before?
So I have worked all over. I started out serving our community with Youth for Christ. I did some work there. I worked at Great Heights for a little while as well. And then I also served at Parkview. And my biggest thing that I love about being in the community, I also worked at Walmart. I worked at Walmart, Southtown Walmart, for several years. I've seen all y'all faces pretty much before. I've seen a lot of people at Walmart. I was a front-end manager, so I've seen everybody. So I just love Fort Wayne, love to see change, love to make things happen.
Yeah, yeah. And so thank you, Cassius. We are welcoming you to the team. Thank you. Thank you. A lot of, so I kind of put Cassius on the spot. Look, he just rolls to the occasion. Anything else that I am forgetting that we want to talk about? Oh, Thriving Thursdays. So next Thursday, we're going to have John here. We have decided to create Thriving Thursdays here at HealthVisions. So on Thursdays during the month, we're going to have programming here, right here in our facility. So we will have some, Peggy is doing some nutrition programming or mental health programming, all of the things that she has done regarding health education. Okay, so we'll be doing some things with Peggy. We'll be doing some Aspire. So look for Thursdays to engage with HealthVisions Midwest. You and or your clients can engage in some of the programming that we will have here. Thriving Thursdays, okay? And what else? Oh, coming up, May 20th, we have our health fair. Please be aware of that. Many of you are involved. Who's involved in our health fair? Okay, yeah, okay, they're kind of shy about it. I don't know why, but many of you are involved in our health fair, our Mind Plus Body Wellness Expo. I know some of the people who are online will be vendors as well. We're going to have screenings at Elevate City Church, and these are all kinds of screenings, y'all. We're going to have HIV, hepatitis C, BMI, blood pressure, immunizations, yes, for children. Shingle shots for people 50 and older. So all of those things will be available. We will have a food truck there. So be aware of that. You will be getting that information. If you're on our email list, you'll get that as well. And June 28th is our next Rethinking Health series workshop. And we're going to have Zachary Benedict. I need to ask y'all a question. So we are going through some things with the room scheduling. All right, I have booked a reservation at the library, for 9:30 in the morning, where we can have Zachary Benedict speak at the theater. How many people would come to a 9:30 in the morning talk? So it would replace this. It's on a Wednesday in June, so it would replace this. You would go to the library. You would go there, you would hear Zachary Benedict. Y'all remember Zach Benedict? He's Citizen of the Year from Journal Gazette. He has some very interesting things to say about social capital, development, and disparities. He's linking that all together. Okay, so it looks like people will come. What about the folks online? Are y'all gonna come? Okay, Nancy has her hand raised. Who's gonna come online? Okay, Yolanda. Okay. Laura has her hand raised. Okay, Laura, I want to see you coming then. Okay, okay, so you will come. Great. So we're going to go with that, Felicia.
I love it.
We're going to go with that 9:30, June 28th at the Library Theater. We're going to have some refreshments out there, and you will enjoy listening to Zach. Anything else from the HealthVisions team? Okay, partner news. What do you all have going on?
We would love anybody to be a part of September 9th event at Faith United Methodist Church. We are bringing Sarah Collins Rudolph here for a free community event. Sarah Collins Rudolph is the sole survivor from the 16th Street Baptist Church bombing, where the 4 little girls were killed in Alabama, in Birmingham. And this year is the 60th anniversary of that bombing. Our Mayor Henry, has made a proclamation, and we'll be giving that. There's opportunities to sponsor, there's opportunities to have an advertisement. Our church is doing a book study of that book, The Fifth Little Girl, and then after the speaking event, there's a meet and greet and a book signing. So you can have your book signed by her. Her sister was Addie Collins. She's Sarah Collins. She was blinded for 3 months. Alabama has yet to pay her 1 dime, no reparations, no anything for her pain and suffering, for anything. Ultimately, we'd like to at some point, we're going to organize something regarding her medical bills, a GoFundMe. We don't know exactly, but at least, which I'm very happy that our Mayor Tom Henry has already made the proclamation. He's going to be present. Our bishop, the United Methodist Church bishop for the state, Bishop Julius Trimble, will be there. So it's open to the community. It's free to the community. We're doing it at Faith, so people of the South Side can access it too.
Okay.
And so shouldn't be transportation issues, but it's from 12 to 3. Doors open at 11:30. I think I've sent Felicia both flyers. I think I sent them yesterday
Okay.
or the day before. So, and so there's a flyer you can get like a quarter page, half page in the program book. Will be a rolling screen for different advertisements when people are entering and leaving. And then there's also just a flyer for information.
So we will send out that information in the next news and events mailing by email. You should all get that, and so that you can learn more about that there. Anybody else have any announcements?
I do. The
Yeah.
YWCA is
Donna?
having a housing and race diversity dialogue on May 18th, and I will be downtown at the library, and that's from noon to 1:30, and you can view that online or live stream at the library. We also have Coffee and Conversation, which is geared towards our eliminating women and eliminating racism and empowering women. We're not eliminating women, but racism and empowering women. That is June 28th, and that's the power of positive gossip, and that's at Brotherhood Mutual. And one of the biggest things that we're going to be putting on short is our Race Against Racism 5K Walk or Run, and that is April 29th. That is next Saturday.
That's this Saturday.
That's this Saturday.
We're there.
We're there.
Yes, yeah.
We're there. That's this Saturday. It will be at PFW. You can walk it or run it. I will be walking it. So I have flyers, and I'll give this to you guys.
Okay, we have a hand and then Keonia. Yes. Ann, you have an announcement?
I do. I have two. CTN is starting a couple new programs. One of them is we are doing a regional needs assessment. Because of the way funding works for transportation, it's hard to cross county lines. So we're working with different counties in the regions and different partners to try to figure out how we get people where they need to go. So we're excited about that. We've got a lot of people on board, and I can't remember the exact dates when the information is supposed to be compiled. Peg, do you?
No.
You
Okay.
can send that to us. Peg, she doesn't remember, but you can send that to us and Felicia will send it out.
Yeah, and then the other announcement is we are starting a new grocery program. We're working with the Housing Authority, and every Tuesday evening we'll be going to a different Housing Authority location. And then we will be doing some on Saturdays as well. So it's a shuttle. So we're working with areas that have a food desert to get people to be able to get healthier food, and it's free to the families. And so I'll send out a flyer with that, and I'll tell people how to sign up and everything. But we're really excited about it, and we hope that it gets utilized. Also, it does not have to be families that are at the Housing Authority locations. If they live close enough to get to the location, walking or otherwise, they're able to take part as well.
Will you have a shuttle schedule out to like send out to locations?
Yes. Yeah, I'll send it out, and then they can distribute it.
Wonderful.
So,
That's-
yeah, we're really excited.
Yes, I'm excited about that as
Yeah.
well. Keonia,
Now, actually, next weekend, May 6th, we have our ribbon walk. So you still have time to register and get your group going. So last year we did really good. And so we're trying to increase our goal, I think, a little higher this year. So definitely get your t-shirts and your groups ready and come out and join us for some fun. And it's only like a mile walk. Not that long at all. So, and then we have our support group, Men Fighting for Health, every second Wednesday. And so, if you know anyone who just wants to get online, who wants to come and listen in, we definitely encourage our women to come and support our men as well. So,
okay. Anybody else? Yes, ma'am. Oh,
I was just gonna say to piggyback off that, HealthVisions is walking in that walk. If anyone, maybe your whole team doesn't want to make a team, but you want to join us, that would be phenomenal. So let me know.
yeah, we need some people on our team, so yes, walk with us. Yeah, okay. Go ahead, yes.
So Associated Churches, we have 9 different programs, but one of them is with our food network. And on Saturday, May 13th, is the National Association of Letter Carriers Stamp Out Hunger Food Drive. So that's when people leave food out at their, by their mailbox, and
Yeah.
mail carriers will bring it to different locations around town. We'll have volunteers there sorting the food that will eventually make it to the food pantries in the community. So just to let people know that that's happening. If you can leave food out for your letter carrier, or if you can help volunteer.
So that food goes to Associated Churches?
It goes to Associated Churches
Oh, okay,
warehouse,
wonderful.
and then we distribute that to the 21 food pantries in our food network.
Leave your foods out, your cans and what have you. For the
Non-perishable.
Yeah, non-perishables for the mail carrier. It will go to Associated Churches, yes.
We have Cassandra Rosine, who has it announced.
Okay, Cassandra. Online.
Okay.
Cassandra?
Okay, maybe she's done. Never mind.
Okay.
She put down her hand. I thought she had one.
Oh, okay. She did not. Anyone else have an announcement that they want to make? Okay, we are grateful for your presence, everyone in person and online. Thank you for coming out. And for those here, please linger a little bit longer, network with one another, grab some snacks, and thank you for coming. Come back again.